Hi, everyone, and thank you for joining us for today's webinar, Medical Fitness 101, an introduction to medical fitness for commercial health clubs. I'm Marianne Murphy, Director of Marketing here at the Medical Fitness Association. I'd like to take a moment to introduce today's presenter. Cosmo Woolen is the Senior Executive at Synergy Cubed, an award-winning consulting company serving the health, fitness, and medical fitness industries. He is a recognized subject matter expert in profit center development, revenue stream optimization, medical fitness integration, retention strategies, sales training, customer engagement, and facility management. Over the past 6 years, Cosmo has cultivated a strong relationship with MFA. He is a regular speaker at our annual conferences and has presented numerous well-received webinars on a variety of topics, and serves as the chair of our education committee. With more than 20 years' experience as a proven effective business consultant to health clubs, we are pleased to offer Cosmo's expertise in all aspects of fitness center operations of your medical fitness facilities and medical fitness implementation at your commercial clubs. Now, a copy of today's presentation slides can be found in the handout section of your toolbar. And if you have any questions as we move through today's webinars, please type them in the chat section of your toolbar, and all questions will be answered in the order they're received at the end. All right, Cosmo, take it away.
All right, Marianne, thank you very much, and welcome everyone to the presentation. We're going to dive right in. I do have one question to start off with everybody. If you could send into your text to Marianne, are you representing a commercial club or are you representing a medical fitness facility? This is all about an introduction to what medical fitness is for commercial clubs, but I'd like to know who out there is representing the medical fitness community so I can address some of your questions as well. So just type that into Marianne and we'll get to that in a little bit. Now, for medical fitness, for all you commercial clubs, medical fitness is a big buzzword. There's a lot of it going around and a lot of people really don't understand what it means or what it could mean for your club. And I know a lot of you recently joined the MFA. We have a lot of new commercial clubs in the MFA, and that's great. And from what I'm hearing from conversations with Jason and the MFA is you certainly want to remain relevant, you want to be essential so you can stay open. Medical fitness can do a lot more than that. So let's dive in. First of all, when you start thinking about medical fitness for all you commercial clubs, rule number one, don't panic. It's not as complicated as some people want you to think it is. There are going to be people who want the commercial venues to think medical fitness is incredibly complicated, so you don't really try to do too much of it. And I think that's totally the wrong approach. So rule number one is don't panic. Rule number two, when in doubt, refer to rule number one. I'm going to walk you through what medical fitness is and what it isn't, so you understand that this is something that you can not just talk about at your club, but you can actually implement in your club to benefit your members, benefit new members, and benefit your bottom line. So let's dive into that. First things first, what medical fitness isn't. Now, for those of you out there that are representing medical fitness facilities, you know what medical fitness is, and what I'm about to address, this doesn't really apply to you in the already in the medical fitness community, because you do a whole lot more in terms of implementation or bringing medical fitness to your commercial club. Let's talk about what it isn't. And some of you may think you made to do this. I'm going to clear your qualms. It is not physicians on staff, lots of expensive new equipment, or complicated protocols for things. You do not need physicians on staff to provide medical fitness at your commercial club. There are ways you can make the connections. We'll talk about all of that. You don't need a lot of new expensive equipment. You really don't. And the complicated protocols, nothing I'm going to describe today is really that complicated. You have to know what you're doing. You have to know how to do it. But the actual protocols to put in place, they're not overly complicated. And I'm going to show you how you can simplify things so that your staff will get it, your members will get it, and you'll get it. So it isn't any of those things. Take a deep breath. Remember rule number two, and let's go on from there. What it is. Now, what medical fitness is covers a lot of things. First of all, by offering legitimate medical fitness in your facility, or some aspect of medical fitness in your facility, first, you can provide a more comprehensive member experience. Think about what you're offering your members. Now, I know with COVID, a lot of you are operating at reduced capacity, which is a challenge, but wouldn't it be great to be able to offer the members that are in the building more of what they're coming in the building for, and to address more of the things that they need from your facility? So you can give them a more comprehensive experience in terms of what you can do for them. So what it is that it is also a more inclusive quality of care. You can provide more things to them that eliminate, to some extent, not entirely ever, but to some degree, the necessity for them to go elsewhere to find some of these things. And again, the more reasons you can give your members to come to your facility, the more loyalty you can drive with your facility. And of course, you can do a lot of things under the auspices of medical fitness that will accommodate this quality of care. You can elevate the care that you're providing, the services you're providing. And when we talk about medical fitness, it's not just about services. Think of it in terms of quality of care, and that will help your mindset. Now, from quality of care, you will have more beneficial external relationships. Now, this is where we really start to uncover why you don't need the physician on your property. You don't need your physician. Medical fitness at the commercial club level is really all about developing relationships with medical providers outside your facility. You've got a physician, maybe a nutritionist, maybe a chiropractor, maybe a physical therapy office, maybe all of the above. By developing relationships, and I'll show you how to do that with those external providers. Look at your facility and look at the community around you. Is there a hospital? Is there a physician's office or a big physician's practice in the immediate vicinity? Is there a nutritionist somewhere nearby that might want to co-op with you for mutual benefit? Is there a physical therapy practice somewhere in your 2, 3, 5 mile ring that isn't already built into a hospital system? Are there other health providers, chiropractors, even massage therapy offices that are in the area? Cultivate relationships with those, and that's a big step towards providing medical fitness services within your facility. And then this, I hope, will ring some of your bells. In addition to all of that, what is medical fitness? It's more profit centers, because a lot of these new services you can offer, a lot of these new benefit to your member services you can provide, that quality of care, well, they are profit centers waiting to happen. And that's really the biggest benefit. The biggest benefit to the members is you provide the quality of care, you provide the added services, you provide the things that will enable them to turn to your facility, to your commercial club, for more of their health and wellness needs. But from a management perspective, these are all potential profit centers if you think of them that way. There is absolutely nothing that says you can't charge for these services. You don't have to give them away for free. I'm not a big fan of giving anything for free. I always tell my clients, don't give away something for free if you are then planning to charge people for it, because it's a double standard. But all of these are profit centers if you do them properly, and I will walk you through how that works. So that being said, let's look at the member experience and the quality of care. Think about your members. What experience do your members go through when they're in the facility? What are they there for? Are they there for cardio? Are they there for strength? Are they there for flexibility? Are they there to chat with their friends? What are they there to do, and how are they implementing that? My guess is everybody that joins your facility has a reason for being there. Nobody joins a gym by accident. They don't join a gym because their wife or their husband is down someplace in the mall shopping and they just want to do something for the moment. They have a reason for being there. Now, your sales representatives, with luck, have had the conversation and understand why they want to be there. But everybody in your facility wants to accomplish something. Maybe it's strength, maybe it's flexibility, maybe it's bulk, maybe it's weight loss, maybe it's all, whatever it is, everybody wants to accomplish something. Ask 20 people why they're there, you get 50 different answers, but they all have a reason. So based on the quality of care, they also have reasons outside your gym, your facility, that they're turning to as well. So let's take a look at this. If you look at your basic football team, And forgive me for using the football metaphor. I know the Super Bowl is coming up. Everybody's got football on the brain. But this should, even if you're not a real sports fan, this should make sense. You look at a football team, they don't just have one person helping them win, do they? They've got a head coach, a running back coach, an offensive line coach, a wideout coach, a coordinator, quarter. They've got all of these different people who are helping that team to succeed, right? Everybody's working to help this team succeed. Now, what do you think the likelihood is? Do you think the running back coach works in a vacuum? Do you think the wideout, I think when I was growing up, they were called wide receivers. Now they're wideouts. Do you think the wideout coach works in a vacuum? Do you think the strength coach works in a vacuum? All of these providers for the team talk to each other. They know what's going on with each player. The head coach is going to talk to everybody, and then the strength coach might work with the quarterback coach to get specific results, and they'll work with the offensive line coach to get different specific results. But they all work together to accomplish whatever is going to be in the best interest of the player, the division of the team. Is it the wideouts? Is it the offensive line, the defensive line? And of course, the team as a whole and the game plan. So there's a game plan from the head coach on down, and they all work together. Now let's look at that in terms of your members. Member experience and your quality of care. Every one of your members has at least one or two of these in place. You have Group X instructors. Many facilities are still having Group X classes, limited basis, lower attendance, but you are still having them. Many of your members may have a physical therapist. Some of them do, I'm sure, or they had one. If you don't have a nutritionist, some people have seen one. Many of your members may have gone to a massage therapist. I imagine they all have a primary physician somewhere. Many of them have seen a chiropractor. At your facility, how many of your members are engaged with a personal trainer? How many of your members have had your basic fitness assessment? So for all of your members, some of them may have one or two of these in place in their overall quality of care. Some of them may have many of them. You may have members that they've got a primary physician, they're seeing a personal trainer, they've done the fitness assessment, they see a chiropractor every now and then, they go to Group X classes, and they've talked to a nutritionist. They cover a lot of the bases. Every member is going to be a little bit different, but they all are going to have this in place. And there are other providers that are not even on this list. You've got naturopathic doctors. You have you've got chiropractors that are here. You've got other health and wellness coaches that may be out there someplace. Lots of options in terms of your member care. So ask yourself this, with your members, all of your members are different. Wide range of members, different needs, different reasons for being there. Take a look at even this sampling. Do you think that every one of these members and every one of these people could be a potential member at your facility in most cases? Do you think all of these people are going to need the exact same care? Would each of these people eat the same meal at a 5-star restaurant? Probably not. So will each of these individuals require the same care programmed the same way in your facility? I would guess that's going to be a resounding no. They don't. They all have very different specific needs. So in order to really provide to their needs as much as possible, the fitness needs are only a small piece of the puzzle. Your personal trainer can do an awful lot. Your facility offers a lot and a little exercise prescription, and then your personal trainer can do more. But if you go back and remember all of the people that may be engaged with these members, there's an awful lot of puzzle pieces that are still being untouched and untapped by your personal trainer. So let's look at how we can create those attachments within your facility. And we do that with external relationships. Here is the typical communication pathway that happens at your health club. Let's look at your typical member. He was one of the group on the list, he's there. Now your typical member, he goes through your fitness assessment, your initial assessment, and maybe hires a personal trainer. Good for you. I think right now, nationwide, pre-COVID, the average, I call it personal training saturation. That's the percent of your active members who were actively engaged with a trainer. Pre-COVID, that number was nationwide averaging between 8 and 12%. That's not a lot. That means you have a huge percentage of your population who are not even engaging with a trainer to get the professional advice they probably need to get where they need to go. But let's assume this individual does work with a trainer. Your typical member has the initial assessment, which gives him a little idea what he needs to do. Now, in many cases, the assessment is not really a comprehensive fitness assessment, is it? Be honest with yourself. Ask yourself a question in these commercial clubs, because I've seen both ends of the spectrum. Is your fitness assessment a true broad scope set of benchmarks for your member to use in their ongoing journey of fitness through your facility? Or is your fitness assessment simply a tool that you give your personal trainer to help sell training? I've seen both. Be honest, because if it's just a tool, you need to expand that. A good comprehensive initial assessment, that's the freebie you give away, but that helps you guide the medical fitness conversation. So right now we're talking about the way you typically do it, not the way I think you should be doing it. We have your typical member, they get a personal trainer. Now, maybe that member talks to a nutritionist. Sometimes it's in the facility. Most facilities, most commercial gyms do not have a nutritionist on staff or on call, so there's one in the neighborhood. And this member, maybe he goes to a nutritionist because he really wants some extra input and really needs some help. So he goes to a nutritionist. And maybe at some point in his life, he has seen a physical therapist. Now, the problem with this is your member's talking to the physical therapist, and your member's talking to the nutritionist, and your member goes through the assessment and talks to the personal trainer. But that's it. You are now relying on the member's understanding of what the nutritionist said to apply it all. You're relying on the member's understanding of the instructions given by the physical therapist to bring it into practice and maybe convey that to the personal trainer. To me, that's a little bit risky. So this is what typically happens. Now, the reason you get into what I call miscommunication is because let's look at some of the options. You have a personal trainer, chiropractor, nutritionist, massage therapist, physical therapist. Suppose this particular member has all of these providers in his life. He's got a primary physician. I think we all have one of those. And we've said he's got a personal trainer. Now, maybe at some point in the past, he had some issues with his knee or whatever, and he went to the physical therapist. And at some point in his current life, he goes to the chiropractor every now and then because the physical therapist is done, but he still gets hurt now and then. Maybe he's talked to that nutritionist we mentioned before, and maybe he goes and gets a massage every now and then because it feels good. So here's the problem that I call miscommunication. All of these service providers know that the others exist. Your primary physician knows what a chiropractor is. Your personal trainer knows about what a nutritionist is and does, probably knows what a physical therapist does. Your physical therapist probably knows that this member may have a personal trainer at the gym. Massage therapist knows what a chiropractor is. Sometimes they even farm out space within the office. But here's the thing. They all know what the providers do. They all know what services the providers provide. They all understand what happens. Wouldn't it make sense for them to talk to each other about this member? The primary physician knows that this member has a personal trainer, but there is rarely ever any communication between the primary and the personal trainer to establish what really needs to happen for this person's overall health. Because I guarantee the physician has information about this person's health and well-being that the personal trainer just doesn't know. And that's not the trainer's fault. They're not trained to ask it. Some trainers are not qualified to interpret it, but they don't have the information. Chiropractors have a very specific scope of knowledge. Physicians don't always like chiropractors. Some physicians understand that chiropractors are not the enemy. They perform different functions. Physical therapists, they know most people when they leave physical therapy are going to go back to the gym if they can. And many of them will try to hire a personal trainer. That's probably the most important relationship to cultivate, because if that therapist can talk to the trainer, don't you think you'll get better results from the member? Better results, better reviews for what the trainer did? And I guarantee something. If a physical therapist talks to the personal trainer and the trainer gets better results from that member, the member is going to see that physical therapist as much more favorable as well because he started the process. So let's look at what communications should look like. True communications. This is what I would like to see in place. Now, do not be put off by the number of arrows you're about to see. This is a best case ideal scenario. I doubt that any of your facilities are going to have all of these pathways in place. That's fine, but try to establish some of them for the benefit of your members. Your member has a primary. Notice the arrow now is two-way. Your member talks to the primary and the primary talks to the member with advice, with input. It's not a one-way street. Now, you put the personal trainer into the mix. You go through the assessment. The primary, talk to some physicians and get input on what type of assessments might be beneficial in your gym. Some things you can do. You want to, if you're getting legitimate BMI information, get that back to the physician. Most physicians do weight tests. They don't do body mass tests. They don't do the same kind of BMI tests. Some do, many don't. But now you get the personal trainer in the mix. Personal trainer is talking to the member. What do you want to accomplish? Well, wouldn't it be a good idea for the trainer to have some conversation with the primary to get an idea of what the primary says needs to happen? Because remember, physicians are not trained in exercise prescription. How many times have any of you here in the seminar, how many of you have been to the physician or you have a friend that's been to the physician because they're a little bit heavy, they're a little bit heavy, maybe they're obese, and the physician says, you need to lose weight, go to the gym. That's the extent of their exercise prescription knowledge. Lose weight, go to the gym. Physicians are not trained at any point in medical school on exercise prescription the way a good personal trainer is. But if a physician can tell the personal trainer, this person needs to lose X number of pounds, let's look at that as a long-term goal. And by the way, his right knee can't handle a heavy workload for the next 6 months. Okay, that's great information to have. Now the trainer can accommodate that information, and you now have a much more effective exercise prescription that takes all of that knowledge in place. You see where we're going with this? A chiropractor. If your member has a chiropractor, why not have a conversation with the chiropractic office and find out if there are any specific things? If you know that this person has a problem with the compression on the lower spine, as a personal trainer, might there be some exercises you are not going to choose to do that you might otherwise plan on using if you didn't know about the compression in the spine? I'm assuming that's a yes. Might there be things that you can do when you're training your client on stretching protocols that will help benefit what the chiropractor is doing? Communication matters. Physical therapist, absolutely. And as we'll talk about, that is the easiest medical fitness relationship to establish. Everybody who's been to a physical therapist will tell you they never want to go through physical therapy again. It sucks. It's painful, it hurts, it sucks. So the best way to help ensure that a physical therapy patient does not have to be a patient again is for the physical therapist to communicate with a qualified personal trainer, not just any trainer, a qualified post-rehab personal trainer, what that patient should and should not do. If those two work together, the patient can become a client and get healthier under the guidance of what the physical therapist has started. The trainer gets better results, the member gets better results, the physical therapist is happier because they don't have to see that patient again in therapy. And here's a little tidbit of information that might make some more sense. Personal trainers in almost every facility I've seen, and I've been consulting for more than 25 years, almost every personal training program I've ever seen is always looking for more clients. They're never full. They can always handle, some cases they want more, some cases they're begging for more, they need more clients. A good physical therapy practice has no shortage of patients. They're always coming in the door, people are always getting injured. Well, if you develop a good relationship with a physical therapist and show that you can take really good care post-PT of that therapist's clients, those are built-in relationships, referrals waiting to happen. I worked with a gym several years ago that developed a relationship with several physical therapy offices in the vicinity, and within 2 years, they were not taking any internal personal training clients. They basically transformed their entire gym into simply a post-rehab personal training facility because all of those physical therapists were happy with the results that patients were getting. I'm not saying that's going to happen to everybody, but if you treat your physical therapist relationship properly, you will have a virtually unending stream of new high-paying clients who simply don't want to go back to a therapist again. If you look at what a physical therapist costs, especially if it's not covered by insurance, even the copays can be high. They get 10 sessions, they get 15 sessions, that's it. No physical therapist is going to tell you that their patient is cured, ready to go back in action after 15 sessions. They're better, but they're not wholly better. And that's where a qualified trainer comes in. So you have to have the communication pathways going in all directions. That nutritionist, yes, the nutritionist needs to talk to the member and get information back and forth. A massage therapist, same thing, has to go back and forth. But guess what? If you've got a massage therapist in-house in your facility, why not have a conversation with a physical therapist as well? If you have a physical therapy practice, those conversations can be beneficial because everybody's working together. And guess what? Everybody should be communicating in some form or another through your facility with the primary. Not inundating the primary with calls, they don't like that. But you have your fitness director or your qualified personal trainers can develop a relationship with the primary that will facilitate those conversations and you run the information through them. This way you are providing that inclusion of care we talked about and you get all this great stuff coming through. Now, let's look at your business model. This is, most facilities think of personal training, and that's the easiest place to develop your medical fitness implementation. Most people think of personal training as a program. I don't, and I'll tell you why in just a minute. But in terms of your inherent focal points of service, your fitness model, these are your primary focal points. Your members have they want gains, they have goals. They want engagement, you want commitment, and they get results. That's typically what happens with a fitness model. This is what people do. Now, when you start talking about medical fitness, you're not so much talking about gains, goals, and engagement or commitment. With medical fitness, you're talking about active aging, post-rehab training, diabetes programs, hypertension programs. You were talking about programs under a doctor's supervision with doctor's input or with physical therapist input that you can now implement at your location in your facility and accommodate all of these things. Remember, active aging is not just chair aerobics. Active aging is taking somebody who's 60 and putting them in a program that will prevent them from needing chair aerobics when they're 75. It's not, try to stay fit when you get old. It's start younger and stay fit all the way through. And remember, this is very important for your members as well. With a fitness program, in many cases, the goal is to gain something, to get bigger, get faster, get stronger, get thicker, get bulkier, get thinner. You're trying to accomplish something that's proactive. With a medical fitness model, more often than not, the goal is not to get bigger, better, faster, stronger. The goal is not to get any worse. It's a different marketing approach. It's a different prescription approach. Active aging, the goal of a 65-year-old member or that gentleman in the chair with the purple dumbbells, he's not trying to bulk up or prime up for a marathon. His goal is to not feel that he's getting any older in his body as he gets older chronologically. People with hypertension, diabetes, their goal is to not get any worse. Diabetes is not technically a curable thing, but it's highly manageable. So the goal with the diabetes program is to manage it with exercise. And you can do that to some extent with doctor's supervision. Hypertension. Hypertension is easily manageable in many cases with exercise if you do it right, but you don't do it blind. Post-rehab, that's where it's so important to talk to your physical therapist and make sure you know what's going on. So think about what is your points of service, how are you going to appeal to your members for your medical fitness programs, okay? So now let's look at your fitness business model. And I ask this, please, if you would like to send Marianne a comment in the notes, please feel free to comment on this question. If you don't want to share, that's okay. I don't share these answers with anybody. This is just for reference during the webinar. But if you'd like to share, please feel free. how many of your revenue streams are underperforming? And by that, primarily, we're talking about personal training, small group training. Those are the big ones. Certainly, pre-COVID, maybe you were doing better. Right now, I'm sure everything's underperforming, but be honest, even before COVID, how many of your revenue streams were underperforming what you thought they could or wished they would do? And we're not just talking personal training or small group. If you have any of these in your facility, Pilates, yoga, assisted stretching, cycling, CrossFit, any of these offerings in your facility, are they generating the revenue you thought they could, you would like them to generate? Because there's probably a good reason that they're not, and it's not the reason you think. Let's look at, so feel free to text Marianne the answers. We'll look at those in a little bit, but let's look at your revenue streams. The two easiest, personal training, small group training. If they are underperforming, chances are they're underperforming because you are probably still 85 to 90% of the commercial facilities in the country sell personal training and small group training as packages of sessions. The 5-pack, the intro pack, the 5-pack, the 10-pack, the 20-pack. If you want to say yes, you do, how do you sell personal training? If you're still selling packages, just text Marianne in the chat, just say yes, packages, so we get an idea of the numbers. I would be surprised if at least half of you at commercial facilities are not still selling packages. Well, when you sell packages, that's one of the reasons that your programs are underperforming. So the first thing you want to do to optimize the existing revenue is stop selling packages. Let me explain why. Because when you start selling medical fitness services, you don't want to sell into the same potentially failing business model. You don't want to sell packages. You want to sell it the other way, and I'm going to explain how. So when you get to the other services, you'll know why. Let's look at your traditional model, the problem with packages. Typically what happens is the member gets 1 or 2 sessions for free when they join. Those sessions are the chance for the trainer to sell them the intro pack of 3 to 5 sessions, usually at a big discount. That intro pack, 3 to 5 sessions, is a chance for the trainer to show them how incredibly knowledgeable, talented, and wonderful they are and sell them the 20-pack. So here's what happens. You get a 20-pack that is designed to be used 2 sessions per week. It should last 10 weeks. And if your state allows it, there should be an expiration, but usually those expirations are 6 to 12 months. So here's what happens. Your member starts to use those 20 sessions. The first 2 weeks, they're motivated, 2 sessions, no problem. Then in week 3, their child's sick, they have to cancel. Because remember, the only penalty is if they don't cancel 24 hours in advance, they lose the session. Otherwise, there's no penalty, no problem. So we're empowering them to cancel. 3rd week, the child's sick. 4th week, because the child was sick, they're absolutely exhausted. You see the way this progression works. All of a sudden, the 20-session pack that was designed to last 10 weeks is now lasting 16 weeks, which means you're getting 0.8 sessions per week, 16 weeks of implementation, not 10. Now, when you have that kind of a scenario, because remember, as long as the member cancels in time, there's no penalty. You, the facility, already have the money, so you don't care. The trainer knows they'll get the session eventually because the client likes them, so they're not really overly concerned. So now what happens is over 16 weeks, the results really take a nosedive because it is just not possible for the member to get the same results over 16 weeks like this that they would have achieved in 10 weeks doing the sessions twice a week as designed, right? So now, in order for a facility to keep making revenue from this member, what must happen at week 14, session 17? What has to happen is your trainer, and I mean no disrespect to personal trainers. I know a lot of them, I like a lot of them, and they're very talented, but trainers are not usually good at sales. In many cases, trainers are the worst salespeople in the building because they don't like doing it. It's not that they're not trained in it, but selling sessions undermines the motivational relationship they're trying to build with their client in the first place, so they tend not to be good at sales. And when you've got someone who's not good at sales, and now on week 14, session 17, guess what the trainer has to do? The trainer has to basically resell something that already has not worked as promised. To me, that's just a bad business model. because you let the member use it for 16 weeks instead of 10, they don't get the results, and then the trainer has to beg them to buy more. Well, I want to give you a new business model that works a lot better. The better mousetrap. Think results-based training. In medicine, when you're working with a physical therapy has specific number of sessions because that's mandated by insurance. But when you're working with medicine, your doctor doesn't think about how many days or weeks or pills. They look at the results you want to achieve. And then they'll tell you how long it'll take to achieve it. Think outcomes and drive incomes. So with a medical fitness model, and you can apply that to your personal training too, think results-based training. You're not going to sell sessions, you're going to sell results. And here's how you do it. This is a broad scope. I'll be happy to talk with you afterwards and show you how it happens. Instead of charging $50 per session for the 5-pack, you get a commitment for twice a week for 3 months. $400 a month, that's $50 per session. Now, if someone buys the 10-pack, maybe it's $45 a session. You give them a discount by buying more sessions. But that doesn't really give them any greater level of commitment. It just makes them spend more money. So if they commit to twice a week for 3 months, it's $50 a session. If they commit to twice a week for 6 months, it's $45 a session. So it's less. But now your commitment is based on the 6 months, not based on the session. Twice a week for 12 months, it's $40 a session. But now they've got a much stronger commitment. And the commitment is they will get the results because that's how it's going to work. 3 times a week for 6 months is the same as twice a week for 12 months, the $40 a session. You're still offering volume discounts on the sessions, but you're not doing it as a price purchase, you're doing it as a commitment purchase. And here's the way it works. The sales pitch is simple. I'll give you a little tweak on this and then we'll move on. Instead of begging them to buy the 20-pack because you're doing it based on price, oh, buy 20, it costs you less per session. That doesn't engender loyalty or guarantee commitment. The sales rep says to the member, look, we've talked about your goals. We can get you there in 6 months. If you commit, we will get you there in 6 months. Twice a week, we'll get you there in 6 months. But here's the thing. We both have a job to do. My job is harder. My job is to provide you with the facility, the equipment, the exercise prescription, the knowledge, the programming, the guidance, the motivation, everything you need to accomplish the goals we've discussed in the time we've discussed. And I want you to hold me to that every step of the way. Can you do that? Fine, get the commitment. Now, you have one job and one job only. Do you know what it is? You need to show up and do the work. And I'm going to hold you to that every step of the way. Do we have a deal? That's your basic sales pitch. As soon as you make it a price pitch, as soon as you make it about the cost of the sessions, you will lose the sale to any other competitor that offers it for less. People don't want to buy price, but people have no problem paying what it costs to really get the results they want. This gets the results. And guess what? After your 3 or 6 month or 12-month commitment, it rolls over to a monthly EFT. You keep getting the money and people don't quit because they keep making progress. People don't quit what works. Now, moving on from that, let's look at your internal profit centers. Remember these? Every single one of these is potentially suitable for medical fitness. Personal training, you develop a relationship with the physical therapy office and you have advanced trainers. They have to be, properly certified. There are lots of certifications out there for post-rehab training, cardiac rehab training. Know what your trainers can do, make sure they're qualified to do what they do, because your physical therapy practices will not refer trainers that have just taken a 4-hour course online and call themselves a trainer. They need to know what they're doing and be able to justify that. But a highly qualified post-rehab trainer is worth more money than a non-certified post-rehab trainer, and you can charge a premium for those services. Now, you've got to be consistent with your model. You can't have a $20 training session for everybody and then charge $90 for your post-rehab trainer, but you can charge more than your standard trainer. Same with small group training if you have post-rehab or other protocols in place. Pilates is great for what it can do. Assisted stretching is a phenomenal profit center waiting to happen. I would be very surprised. Looks like we have 60 people in attendance now. I would be very surprised if more than 4 or 5 of you have an assisted stretching profit center operating in your facility right now. It's one of the easiest to implement, and that's very definitely qualifies as medical fitness, because if you can perform these implementations under medical direction, you don't have a doctor on premises. You are in communication with the physician. You're in communication with the physical therapist. That's what gives you medical fitness, is the medical direction for what you're doing. You have a physician look at the exercise prescription, provide input. You have the physical therapist work with the trainer to get things started. You provide medical direction from the people that have the medical training, and then you can legitimately, so you have medically directed fitness. It's not the same medical fitness you'll find in a medical fitness facility. You're never going to have that. But you're not trying to have that. You are not trying to replace the medical fitness facilities for what they can do. They have all the fancy equipment, the physicians on staff, and they take this to a whole nother level. You're not going to try to be them. It's a huge investment in manpower and equipment and a bunch of other things, and certifications that they have that you don't. But medically directed fitness, that can very much make you an essential facility if you're providing post-rehab services, medically directed services. Make those connections. Now, not all of these profit centers, not all of these systems will work for medical fitness, but many of them can. Think of revenue opportunities. Pilates is an opportunity. Assisted stretching, absolutely. Yoga. Maybe indoor cycling and CrossFit, not so much. It depends on what the deal is. Aquatic, water fitness is absolutely a good way to do it if you have a pool that's open. And some pools are just starting to reopen, not for the general public, not for group exercise classes, but if you have a pool and it's not being used, you might be able to open it on a limited basis for one-on-one or one-on-two medically directed fitness aquatic rehab. It's a very useful rehab that you can use, and that might be a way to ease people back into the pool. And then remember these: post-cardiac rehab personal training, post-rehab personal training that isn't cardiac, after knee or hip or shoulder work, prenatal personal training, pre-surgery personal training. Ever thought about that? Someone going in for surgery, there is often things they can do pre-surgery that'll make their recovery faster. All of those are internal profit centers if they are medically directed. If you develop the relationships with the facilitators on the medical side. And that's the thing you need to do. Don't try to implement these just solo. The devil's in the details. These are all profit centers waiting to happen. But you need to know how to do it properly. You need to really be well directed with the medical. I cannot emphasize enough, bringing medical fitness to your facility, it's not just about claiming what you have. It's not just about saying you can do post-rehab or saying you can do prenatal personal training. It's having the medical relationships, the clinical relationships with a physician, with a hospital system, with a physical therapy office, with the chiropractic practice, with any and all of the above, with the nutritionist. It's having those relationships that you can then bring to benefit on all of your members. You have a nutritionist nearby, invite them to come in once a month and do a complimentary seminar, a 1-hour lecture on nutrition. Let the members see who they are, develop the conversations. Maybe they'll get some outside clients, but you can also develop the relationship and work out some referrals. There are lots of ways you can do it. I'll be happy to talk to any of you individually about how you set these things up. But that's a really good way to go. So let's summarize a lot of what we've talked about. First, embrace the new normal. Health and wellness is an integral part of fitness. Years ago, fitness was just weights and cardio and that's it. Then yoga came in, then Pilates came in, there's all these other modalities came in. Health and wellness, it's not just about fitness anymore. It's about wellness, health, whole body, lifestyle. That's all part of the new normal. And as a commercial club, you have to be able to embrace providing that caliber of service to some extent through medical connections. Remember not to panic. The new normal, think of it as new opportunities. If you truly embrace medical fitness, and there are lots of ways to do it through personal training, through assisted stretching, and through a couple of other things that we've talked about, there are lots of ways to do it that really require very, very little investment on your part except the time to make it work. You don't have to buy a lot of stuff. You don't have to hire a lot of people. You have to put in the time to make it work. And that's what I love to, I can show you how to do that. But don't panic. It's new opportunities. Instead of medical fitness, think medically directed. you are not going to be a medical fitness facility. I mean, some of you may want to expand to that. That's up to you. MFA is great at helping people do that. But think medically directed. Think of how much more you can provide to your members, how much benefit, health benefit, wellness benefit, physical fitness benefit, if you have medically directed programs and protocols. Work with a personal trainer. Do all of that stuff. Work with a personal trainer. Work with your physical therapy practice in the neighborhood and be medically directed. And with all of the above, increased public interest equals revenue opportunities. The public is very aware of health and wellness right now. Everybody is thinking about COVID. Everybody's thinking of being safe and healthy. And everybody wants to be healthier because healthier people are less likely to have problems with COVID. So health and wellness and fitness are all very much in the public's mind. Medically directed is a big deal. If you are medically directed, if you have legitimate medical fitness in your facility, not only does it allow you to offer a whole new scope of services, but wouldn't that also offer a whole new level of confidence to your members that you know what you're doing and you're going to take good care of them? And all of those things are potentially revenue generating situations. So with that in mind, that's the bulk of the information I have, but I am sure we have some questions. Marianne, any questions you have? I hope we've got a bunch of them coming in. Marianne, please come back on and let me address some of your questions. I want to make sure to answer as many of them as possible while we have time in the session. And before Marianne starts, I do want to thank everybody for your attendance and for listening. It's been my pleasure, and I look forward to working with all of you, any of you, to actually make this stuff happen in your facility. Marianne, what do we have?
Sure. Thanks, Cosmo. So we have a question. I'll just read them in the order they're received. Ginny has a couple of questions. How do you manage communications to the member/patient for cost of services? So speaking to the physician, patient needs to do X, Y, and Z, but each of those services are a cost.
Well, the physician communication is that if the physician has a good relationship with you, the physician can tell their patient, you know, I've been working with this facility and they can take good care of you in regards to A, B, C, and D. At your facility, you just have to have a good price list. You have to have a predetermined list of what your services are going to cost, and don't try to do what a lot of clubs do, and that is make stuff up on the fly because it sounds good. You don't want to discount to make the sale. Your services cost what they cost, but you're not selling it on price. You're selling it on fitness, on capability, on your doctor said you need this, we can help you accomplish this, but this is what the program costs. This is why it's very important to set up your pricing structure to be consistent with your existing member prices, your existing training prices, and your demographic. And I can show you how to do that, but you don't just want to throw prices on it because you can. It's got to be consistent, otherwise you will price yourself out of the market and it won't work. I think that answers you, Jay. Hope it did.
Okay, so Ginny also asked, how do you manage release of patient information? We all know that's a tough one.
Yeah, HIPAA compliance is a big deal. Basically, your patient, your member, can do that with a simple HIPAA form. They give the doctor permission to discuss aspects of their condition with you. It's a HIPAA form. I would advise everybody that does want to implement this, always have one communication with your attorney to discuss what HIPAA forms are necessary. I am not going to say one form will do it in all cases, but there are very clear, easy to understand HIPAA release forms that will allow the physician, physical therapist, chiropractor, whoever that medical provider is, with patient's permission to discuss aspects of their health and wellness or care with designated people. And that could be the representative of your facility, which is likely going to be your fitness director or your personal trainer. So it's just a matter of knowing you have to have that permission in place. And if the patient wants to share that information, it's up to them. HIPAA follows the patient. If the patient says you can all talk about it, then you can all talk about it. That much I do know.
We had when you asked about selling packages, yes, we did have a few people who said, yep, we're selling packages.
For those people, yeah, for those people that are still selling packages, please reach out to me. Unfortunately, packages are still the common things in the industry. The business model that I showed you has been proven to be significantly more effective simply because packages, you're selling the wrong thing. You're selling price, you're selling blocks of time. You're not really selling the commitment to what works. And if you get people results, they don't quit. Love to talk to you about it. But if you're still selling packages, it's not hard to make the transition, but you have to do it the right way. But
Yeah, I
thanks for
will.
letting
I
us
will
know.
add that when you were talking about, not selling packages, Jared chimed in and said exactly right.
Yeah, thank you, Jared. Yeah, with no disrespect to personal trainers, I said I love working with them, and I've got a lot of good friends that are trainers. They tend to suck at sales because they don't enjoy doing it. They don't like to do it. It's not part of what they're trained to do. With my personal training model, trainers get to do what they like to do, what they are trained to do. They have to be good trainers, period. Because if you can get results, A, people don't really mind paying for what works, and B, as long as it continues to work, they're not going to mind keeping going. You will have a much lower attrition rate of your training. And anybody that sells packages, if you look at your numbers, don't just look at what are your training sales every month. Look at how many of those sales are new clients versus how many are renewing clients. Because packages, ultimately people stop renewing because they're not getting the value, the benefit of what they're paying for. And that's where it comes down to.
So,
What else?
Jared also asked, what about partnerships with Weld and insurance reimbursement for TE's units, etc.?
Always a good idea to discuss. Certainly you can discuss that with the insurance carriers. It's still a little bit of a gray area because some insurance, they'll cover physical therapy. They won't always cover post-rehab therapy. It depends on the insurance provider. I would love to see the industry evolve to where a lot of these services are recognized as beneficial at a lower cost, because right now insurance will cover X number of physical therapy sessions and they're expensive, but that's it, they'll stop. I would love to see the industry evolve, and I know there are several people who are working very diligently on getting Washington to understand some of these changes. I know Bob Boone, MFA's president, is doing a lot behind the scenes to push the knowledge of what medical fitness is and why it helps across the board. Very proactive in that, is a true champion of this cause. Ultimately, it would be great if the insurance companies will recognize that they pay for 10 physical therapy sessions, then they should pay for 20 personal training sessions, which will cost probably less than the physical therapy sessions and will help ensure that patient doesn't have to go back to physical therapy again. It's got to be a collaborative effort, and at some point we may get there. It is also possible, depending on the insurance, that they may cover some of the equipment necessary, although they won't cover the training itself. But that's a question that your patients would have to have with their insurance carrier. But we're hoping to evolve in that direction because it has been proven that good post-rehab personal training will prevent the need to go back for physical therapy for the same thing. So it is a cost savings to everybody in the long run, and it's much better for the patient. So we're working there. It's a great question, Jared. I appreciate it. We're trying to get there as an industry. Unfortunately, we're not there yet, but we are making progress.
Awesome. Well, we just had a comment from Coach RGT. Quality always works better than quantity.
Absolutely, RGT, you are so right. This is one thing to make these relationships work, whether it's with a chiropractor, a physician's practice, a physical therapy practice, any of them. To make these work, you have to have people in your commercial facility that are qualified to push these relationships forward. Also, talk to me, because the proposal you give to the physical therapy practice, you have to have your T's crossed, your I's dotted. You've got to prove to them that you're worth a relationship. You can't just have somebody, one of your salespeople, going, hey, I want to generate referrals. Can we work together? You have to have a comprehensive game plan, and I can show you how to do it. Let me say this to finish up. Medical fitness is something that you have to take seriously in your facility. It doesn't cost a lot of money to implement. It doesn't make a lot of changes to implement. You don't need lots of equipment or lots of fancy new staff, but you have to be serious about what you're doing. You have to have a good overall game plan and cross all the T's and dot the I's, because if you do it haphazardly, you will not develop the strength of relationships you need to make it work. Take it seriously and you have a long-standing benefit to everybody. Patient, member, bottom line. Do it, but do it right.
Great. So, Cosmo, we have probably time for one more question. What steps have fitness centers taken to become an essential business? And is the association with Medical Fitness Association a good first step?
The association with MFA is an incredibly good first step. One of the reasons that so many health commercial clubs have joined MFA recently is because it is a large step into becoming essential. A gym all by itself is not necessarily an essential facility. Medical fitness, it's not a guarantee of being essential, but it does go a long way. The laws are changing, the guidelines are changing, and that's a question that I would actually ask to MFA directly, not through me, because they are more conversant in that. You can talk to MFA. I think maybe talk to Jason. He can give you a better idea about that. But medical fitness is absolutely a very critical first step towards becoming essential, in addition to all of the other benefits it provides to your members and to your bottom line. It does carry a lot of weight in that. Let MFA walk you through that side of the conversation. And yes, absolutely, joining MFA is a huge step in that direction, because it, among other things, has brought you here, and you now have a lot of the information to take those first steps. And I love to work with each and every one of you individually to make sure that you're doing it well, doing it right, and setting it up for long-term fiscal success as well as member success. And with that, I know Marianne has to sign off. Thank you all for your time and energy, and I'll turn it over to Marianne.
And Jeff, I'll just add to Cosmo's answer. Yes, please contact the Medical Fitness Association. We have talked to many centers about being essential. It changes state by state. We have talked to public health departments. So yes, give us a call and we can talk you through that. I don't see any more questions coming through, so I will say thank you, Cosmo, for sharing your knowledge with us today. All attendees will receive an email with a speaker evaluation for today's webinar, and it includes a spot to indicate which continuing ed credit you'd like to receive. So be sure to complete the survey and return it to us. Your feedback helps us in planning educational webinars and helps our speakers with their presentation skills. We have many more webinars coming up, so please visit the MFA website at medicalfitness.org for a complete list of topics, dates, and times. Our next webinar will be on February 10th, again with Cosmo, kind of a follow-up. Cosmo will be presenting on why medical fitness facilities should embrace the addition of commercial health clubs to the MFA family. If you have a topic you'd like to see us cover, or if you have knowledge you would like to share in an educational webinar or even a conference session, please visit the MFA website, click on Education, and then click either Submit Topic Ideas or Submit Presentation for the online form. Thank you again for joining us today, and to Cosmo for sharing his expertise. Enjoy the rest of your day, everyone.